You're lying on a wooden table, the room is crowded, hot, and smells of sweat, fear, and something metallic and sickly sweet. Your leg has been crushed in an accident, mangled beyond repair, and the man standing over you says it has to come off. But there's no anesthesia, no painkillers, no sterile room. Instead, 4 burly men, reeking of gin, grab your arms and your good leg, their knuckles white as they pin you to the blood-stained wood. The surgeon, a man in a frock coat so stiff with the dried gore of past procedures that it could stand on its own, pulls out a saw. Welcome to 18th century surgery, where your odds of survival were worse than a coin flip, and the cure was a descent into a waking hell more terrifying than the disease itself. You're about to discover a world where surgeons were praised not for their precision, but for their brutal speed, where the best operating theaters were packed with a screaming, cheering audience, and where the most common sound wasn't a thank you, but a prayer begging for a swift death. Forget horror movies. This was real life for your ancestors. These are the shocking, documented realities of surgery before anesthesia that will make you want to fall to your knees and kiss the floor of a modern hospital.
Part 1. The Butcher's Apron, the Surgeon and His Sinister Tools. Let's begin not with the procedure, but with the man you have entrusted with your life. In the 18th century, the man called a surgeon was not the respected, godlike figure you imagine today. Society had a rigid class system for medical men. At the top was the physician. He was a gentleman, a university-educated scholar who studied texts from antiquity. He would diagnose your illness by discussing your humors, examining your tongue, and analyzing the color of your urine. He would never dream of getting his hands dirty. That messy manual labor was for the tradesman, the craftsman, the man at the bottom of the medical hierarchy. The surgeon. Surgeons were often grouped with barbers in what were called barber-surgeon guilds. For centuries, the man who cut your hair and shaved your beard was the same man who would pull your teeth, drain your abscesses, and cut off your limbs. They learned their trade not in pristine universities, but through brutal hands-on apprenticeship, often on the gore-soaked battlefields of Europe's endless wars. And they looked the part. A successful surgeon was a walking biohazard. His status symbol wasn't a clean white coat, it was his work coat. A heavy frock coat, caked and hardened with layers upon layers of blood, pus, and tissue from hundreds of previous patients. They would boast about how long it had been since their coat was washed, as if each stain was a medal of honor. The idea of washing it or their hands would have been seen as absurd, even insulting, a sign that you were a novice who hadn't yet earned his bloody stripes.
This wasn't just arrogance, it was rooted in profound scientific ignorance. The concept of microscopic germs was still a century away. The prevailing belief was the miasma theory, that disease was spread by bad air or foul smells. As long as the room didn't have the specific stench of rot they associated with plague, they believed it was safe. The metallic tang of blood, the reek of unwashed bodies, the sharp odor of fear sweat, these were just the normal smells of the trade. They had no idea that the real killer was invisible, clinging to their unwashed hands, their filthy coats, and their terrifying tools. And oh, the tools! An 18th century surgeon's toolkit was a collection of horrors. For an amputation, he would lay them out on a velvet-lined tray. The long, curved amputation knife, designed to slice through skin, fat, and muscle in a single sweeping motion. The capital saw, a large-toothed, brutish instrument that looked more suited for logging than for medicine, designed to rip through bone as quickly as possible. Dozens of small, torturous-looking hooks for pulling back flesh and snagging arteries, and fine silk thread for ligatures often held between the surgeon's teeth during the procedure, soaking in his saliva before being used to tie off a bleeding vessel inside an open wound. None of it was sterilized. The surgeon might give the blade a token wipe on his apron, transferring the dried blood of last week's victim onto the fresh wound of this week's victim. You don't learn this in history classes out there, but this complete disregard for hygiene created a phantom killer that stalked every hospital in Europe. Hospitalism. This was the name they gave to the rampant deadly infections that were so common, they were considered an unavoidable part of recovery. A patient might heroically survive the agony of an amputation on the table, only to be moved to a crowded, filthy ward where their open stump would inevitably begin to fester. Surgeons would watch for the formation of what they called laudable pus. They genuinely believed that a thick, creamy yellow pus oozing from the wound was a good sign, a sign that the body's evil humors were being expelled. In reality, this laudable pus was the calling card of a raging staphylococcal infection. It was the sign that sepsis was setting in, that gangrene was about to turn the flesh black and putrid, and that the patient was about to die a slow, agonizing death from a fever that no one could explain. The very man who had saved them on the operating table had with his own hands delivered their death sentence. The surgeon, his coat, his tools, and his profound ignorance were a far greater threat to the patient than the original injury itself. And if you somehow survived his unclean presence, then you had to survive the procedure, a procedure where your only hope was that the man holding the saw was very, very fast.
Part 2. Faster is Better, the brutal ballet of speed surgery. In the pandemonium of the pre-anesthetic operating theater, there was no room for delicacy, no time for precision. There was only pain. A pain so absolute, so soul-shattering, that it could kill a person from shock alone. In this reality, the only virtue a surgeon could possess was speed. The entire procedure was a frantic race against the patient's consciousness and the limits of human endurance. A great surgeon was not a healer. He was an artist of expedited butchery, and his reputation was measured in seconds, not in successful outcomes. The most legendary of these speed demons was Robert Liston, a Scottish surgeon working in London, who earned the title the fastest knife in the West End. Liston was a showman. He was tall, powerful, and famously gruff. He would stride into the operating theater, packed to the rafters with breathless spectators, and bellow, "Time me, gentlemen, time me," as he rolled up his sleeves. His speed was the stuff of legend. He could amputate a leg from the first incision to the final stitch in 2.5 minutes. He once removed a 45-pound scrotal tumor whose owner had to carry it around in a wheelbarrow in just 4 minutes. To the terrified patient strapped to his table, this speed was their only mercy. For every second saved, that was one less second of indescribable agony. For the students and onlookers, it was a thrilling, high-stakes performance, a ballet of blood and bone.
But this obsession with speed came at a terrible price. In the rush, catastrophic mistakes were not just possible, they were frequent. And it was Robert Liston who had performed the most infamous operation in the annals of medical history, the only known surgical procedure with a 300% mortality rate. Picture the scene. The theater is packed, a man is brought in for a leg amputation, he is held down, screaming. Liston enters, nods to the crowd, and pulls out his knife. "Time me, gentlemen." The clock starts. Liston works in a blur of motion. The knife flashes. But in his haste, as he brings the blade around to cut through the muscle, his assistant, who is restraining the patient's leg, flinches. Liston's knife doesn't just cut the patient, he slices clean through the fingers of his young assistant. The assistant shrieks, but there's no time to stop. Liston grabs the saw. The grating sound of metal on bone fills the room. He powers through the femur in seconds, the severed leg tossed into a bucket of sawdust. The operation is over in under 3 minutes, a triumph of speed.
But the carnage wasn't over. As the patient is carried out, he is already pale from blood loss and shock. The assistant, clutching his bleeding hand, is in similar distress. Both their wounds, exposed to the filth of the theater and Liston's unsterilized tools, would soon become infected. Both the patient and the assistant would later die of sepsis. That's a 200% mortality rate. But here's where it gets truly insane. During the procedure, in the whirlwind of his sawing and cutting, Liston had swung his knife so wildly that he had slashed the coattails of an elderly, distinguished spectator who was watching too closely. The old man, feeling the blade rip his coat, was convinced he had been stabbed in a vital organ. The shock was so great that he dropped dead from a heart attack right there in the gallery. 1 operation, 3 deaths. The patient, the assistant, and the spectator. A 300% mortality rate, all in the name of speed. And Liston was the best. Napoleon's chief surgeon, Baron Dominique Jean Leray, perfected the art of battlefield amputation, turning it into a gruesome assembly line. After the Battle of Borodino, he claimed to have performed 200 amputations in just 24 hours. Imagine it, a tent filled with the screams of hundreds of men as Leray and his assistants moved from one soldier to the next, a relentless, non-stop conveyor belt of sawing, with a mountain of severed limbs piling up outside. This was the world of 18th century surgery, a world where the most celebrated practitioners were men who could dismember a human body with the terrifying efficiency of a slaughterhouse. Their speed was a desperate response to an impossible problem, but it created a spectacle of such primal horror that one has to ask, who on earth would choose to watch it? The answer is even more disturbing than the surgery itself.
Part 3. An audience for agony. The operating theater. If you thought the experience on the table was a nightmare, imagine the view from the gallery. The very name we use for the room where surgery is performed, the operating theater, is a direct, chilling legacy of this era, because that's precisely what it was, a theater, a public venue for a spectator sport where the main event was the methodical, conscious dismemberment of a fellow human being. And it was one of the hottest tickets in town. The architecture itself was designed for voyeurism. Theaters were built as circular or semi-circular rooms with steep, ascending tiers of wooden benches, exactly like a university lecture hall or a small Roman Colosseum. In the center, under a large skylight designed to provide the surgeon with the maximum amount of natural light, stood the operating table. It was no more than a sturdy wooden plank, often with worn leather straps to restrain the patient. It was permanently stained with the dark, almost black residue of countless prior operations. There was a bucket of sawdust on the floor to soak up the inevitable deluge of blood, and another for the severed limb. This was the stage.
The audience was a curious mix. First, there were the medical students. For them, this was the raw, unfiltered textbook of their profession. They would crowd onto the benches, craning their necks for a better view, frantically sketching diagrams in their notebooks, trying to memorize the surgeon's technique amidst the chaos and the screams. This brutal exposure was a core part of their education, designed to harden them, to desensitize them to the human suffering that was an unavoidable part of their future craft. Then there were the other surgeons, the colleagues and rivals who came to watch, critique, and learn. They would murmur amongst themselves, judging the lead surgeon's technique, second-guessing his incisions, and sometimes even offering unsolicited advice from the gallery during the procedure itself. But the most shocking group in the audience was the general public. In an age before television or professional sports, public spectacle was a primary form of entertainment. People flocked to public executions, and an operating theater offered a similar, if not more intense thrill. For a small fee, anyone with a strong stomach could buy a ticket and watch the show. They would cheer when the surgeon entered, gasp when the first cut was made, and fall into a hush at the high-pitched grating sound of the saw on bone. They were watching a life or death struggle, a drama of blood, screams, and steel, and to them, it was utterly captivating.
We have a first-hand account of what it was like to be the star of this horrific show. The famous novelist Fanny Burney underwent a mastectomy in 1811 for what was believed to be breast cancer. She survived and wrote a letter detailing every agonizing second. She describes being laid on the table, a cambric handkerchief placed over her face, not as a mercy, but simply so she couldn't see the knife. She writes of the 7 men holding her down, the surgeon describing her breast as being in a dreadful state. Then she details the moment of the first cut. I began a scream that lasted unintermittently during the whole time of the incision, she wrote. I felt the knife rattling against the breastbone, scraping it. She was conscious of everything. The surgeon's hushed instructions, the smell of her own blood, the feeling of the blade separating her from her own body, all while being the central focus of a room full of strangers.
And after the limb or tissue was finally severed, the ordeal wasn't over. The final act was cauterization. To stop the bleeding from smaller vessels, the surgeon's assistant would bring out a brazier of glowing coals, from which he would pull a cauterizing iron, a metal rod heated until it was white hot.
This would be pressed directly into the open, raw wound. The sizzle of flesh, the plume of acrid smoke, and the new, even more piercing shriek from the patient was the grand finale. This final, searing agony was often the thing that pushed the patient over the edge, into the blackness of shock or death. This was the complete experience of 18th century surgery, a performance played out by a filthy surgeon celebrated for his speed before a baying crowd upon the writhing body of a conscious patient. It was a world of institutionalized torture, all performed in the name of medicine. So the next time you are wheeled into a silent, sterile, and private operating room, take a moment. The greatest miracle of modern medicine isn't a complex transplant or a life-saving drug. It is the simple, profound mercy of not having to be awake for it.